back, everyone, to another edition of Disruptive Dental Science, brought to you by Dental Advisor. I am Dr. Ashton Prince. I'm going to be your host today. I'm one of the clinical ambassadors with Dental Advisor, and I am joined today by a fellow dentist, a fellow colleague, all the way from the Bay Area of Walnut Creek, California, Dr. Troy Schmedding. Dr. Troy, it's a pleasure to have you with us. And if you wouldn't mind, tell everybody kind of who you are so they get the chance to meet you as well.
Great. Well, thanks, Ashton, for the nice introduction. I'm Troy Schmedding. I'm a general dentist in Walnut Creek, California. Got a very heavy restorative type practice based on a lot of function and aesthetics, what we like to call ourselves. Let's see, a little bit of a story I have. I've had a few practices in my life. I graduated from UOP here in San Francisco, and I moved back up to Seattle. I'm a Washingtonian by birth, and I started my career up there where I had a practice for about 16 years in Issaquah, Washington, for any of you out there that know Washington at all. And I decided, kind of had a midlife crisis, maybe we'll call it, and decided to do a pivot and change my career around a little bit, and I got into academics, which brought me back down to UOP, where I taught for a few years. And as things kind of go, and living in the Bay Area being so cheap as it is, it was hard to make a deal with things. So ended up back in private practice, and that's been kind of my bread and butter for the last 10 years down here. And so, yeah, it's been good. It's been a wild ride, but one I probably wouldn't trade for the world at this point.
Beautiful. Absolutely fantastic to have you with us today, Troy. So being in education, transitioning to private practice, feeling like you needed that ability to pivot, what drew you to that? What made you think, I got to get out of education? I got to go back into private practice?
Well, the education side is fantastic. It really is. But I think my downfall was probably having my own practice prior to doing that.
Got it.
And not that it's a negative thing, but certainly going through the channels of education and trying to change things, do things maybe a little bit different can be challenging.
Sure.
Even just a simple conversation about changing the composite we use in the clinic would take 6 months of conversation. And it's a little bit difficult when you come from we're here the sole decision maker and you're calling all the shots in your own practice and whatnot. But I really truly enjoyed working with the kids and, helping that side of it. I really got, a great thrill out of it. And the other thing that really came out of it was allowed me to meet a lot of companies and different things I've started to work with since. So I've been lecturing for the last 8 or 9 years or whatever it's been. So it's really been kind of a twofold kind of situation where I still do my private practice, but I was able to gain the ability to go out and do some lecturing and some presenting, which has really kind of given me a bridle in dentistry, because I found myself, my original first half of my private practice life being kind of bogged down a little bit, like most dentists probably get, in the sense
Sure.
that you're tugging away 4 or 5 days a week or whatever it may be. And maybe in your own practice, a solo practice, it gets kind of lonely a little bit sometimes. And so you find yourself looking for different outlets. So that pivot I made has really been a good thing for me in terms of just the diversity of my career now is what's happened.
I love it. I've been in the same way. I was 15 years solo practice, and then I finally figured out that being surrounded by as many women as I was constantly, I needed a little bit of some masculinity to be brought in. So I hired on an associate to kind of help me out, broke up the monotony of it. But I've also been doing the same kind of thing in lecturing and teaching and doing this kind of thing in the evaluations and whatnot. And it's been a lot of fun just to break that up, just to get a little bit more of an energetic kick for ourselves so that we can kind of get back into what we actually do. So I'm really, really intrigued then. If you've seen the education side, you've seen the private practice side, you've seen the positives and the negatives that can kind of come with both. I am curious over the past couple of years to what you've kind of seen has been the trends within dentistry itself. Have you noticed any at all?
Well, coming from the younger sector, the young dentists coming out, they're really faced with a lot of obstacles, more than, I think we all probably had student debt to some degree. I'm sure the level of increase has gone to the points where it is now. There's students over $500,000 coming out of debt.
Easily, yeah.
Yeah, it's just mind blowing if you think about that. And so a lot of it, and when I first came out was, yeah, I'm getting my own practice, I'm doing my own thing kind of thing. And now you see a sense of, well, I think I'll go work for corporate. I'll think I'll be an associate. I'll
Right.
think I'll do. So the lack of ownership is kind of something that a lot of these kids don't want. And I understand it. But I also feel sad in the sense that I think they're missing out on a very big part of one of the great things of dentistry still today is that ability to have your own business. I mean,
Sure.
very few things you can own anymore by yourself as far as a business. I mean, it's just hard in the terms of battling with a lot of the things that come along with it. So I feel sad in the sense that they're missing the boat on that opportunity. The corporate side is really starting to jump into these all these avenues, even for retiring dentists, right? So a lot of
Right.
things are spinning and turning in that sense. So there's a big shift coming in dentistry, I think, in terms of where things are looking. I hope we as dentists don't give up full rein on what we're doing. I mean, I still think private practice has a great place, and I think it's still going to have a niche market. And I still think it's going to be a big part of it and a great opportunity. I mean, I don't think that you would or I would probably trade what we've done to this point in terms of, owning your own business. Sure, is it challenging? Yeah. I mean, but is everything challenging? Yeah. I mean,
Oh,
everything
without a question.
right? So, I mean, yeah, that's kind of where I see things. It's just that lack of wanting ownership or scared, or maybe even not even the ability to have ownership anymore because of their financial debt that they're coming out with.
It's getting to the point where I heard the minimum of coming out of school, and then granted, this is just kind of some hearsay at times. I might want to research this out a little bit, but I've heard a minimum of $400,000 in debt just trying to get out of school, and trying to even picture getting out of that. It's almost as though they're being a little bit forced to have to go into either a corporate destination or anything along those lines. Which, as you said beforehand, being in education, it would take you 6 months to try and transition from one composite to a different composite, which would be about the same situation as being in a situation like this, which for us, it takes away from that ability for us to practice as we see fit. I've found it really interesting to see that when you have a certain mentality as a dentist, some people are a little bit more conservative, others a little bit more aggressive, others are looking down that homeopathic style biomimetics or things along those lines. And you have that autonomy where you can do that kind of stuff if you actually maintain ownership. You also mentioned a little bit within retirement. My office now kind of is my retirement plan for the most part, that I can now transition that into allowing somebody else to do it whenever they want to. I can maybe work a day or two a week when I get old enough that I can't handle this anymore. But there's so many benefits that can come to this. But you said a term that clicked for me just a little bit. And you said maybe sometimes people fear being in private practice. Tell me what you mean by that.
Well, I mean, it's a risky endeavor, right? I mean, in terms of you come out of dental school and you don't really know much about business. I mean, I think that's, just a situation that happens is you have so much to learn in dentistry and so much to accomplish. And then they throw you out into this big world of trying to establish a business. And we all laugh. I mean, we can laugh about it, right? Because
We can at this point, we can, but not
yeah.
back then. We couldn't.
Yeah, because I didn't know what the hell I was doing. I mean, I was clueless as to how I was supposed to run this practice. Unfortunately, I bought an existing practice, so I had
Sure.
someone to help me. And I think that's really one of the great things of dentistry was just that early mentorship that you got from hopefully a nice older dentist that you bought from. But yeah, I mean, the fear is tremendous, and I don't know if that's a bad thing. I mean, I think fear makes a lot of change in a person and creates a better individual at the other end. And so having the ability or the desires to do that is my biggest concern is I just don't know if there is desires out there for people to try to accomplish that goal.
Yeah.
Because it is new, it is different, right? And they can't afford to fail and they're scared to fail. And I get it. For sure. I mean, that's kind of what I meant by that.
Um, the designation, as soon as you graduate from school and you're dictated now as a doctor, all of a sudden we get this feeling that we're supposed to know everything that happens, everything that goes on. We're supposed to be fully understanding of all of our situations, that we're supposed to be intelligent enough to know what's coming at us. And we really have no idea. Now, for me personally, it took a number of years until I could even feel confident and comfortable in my own office, without having to have somebody looking over my shoulder constantly as to what I was doing. But there's a lot of benefit that comes from this, a lot of learning that comes from this. When it comes to that fear, I've loved trying to assist those that are of the younger generations, and to be honest with you, even those a little bit that have been more experienced that just kind of get lost along the way. of trying to regain a desire to get back into where we actually see the benefits of dentistry actually going, because it changes, as you've seen in education, if you've seen in private practice, you've seen all of these, it seems to alter itself all the time, in different products, different materials, different methods, different protocols, different ways, different legalities out of things that we get from different organizations. It's so much that it is constantly pulling at us, that for us to be able to maintain a level of, again, I'll say confidence, a stress-free environment, anxiety to be diminished, to be a small business owner for those that own their own practices, to be a team leader, to actually even show leadership qualities in the first place. None of that was shown to me or taught to me during my days in dental school. So when you do graduate from school and you're thinking, where in the world am I going to go with this? And I can't fail because I'm this far into debt. There's so much that goes into it that, man, we get lost. We get lost quickly. So for your situation of things, what are a few little tidbits or things that you could actually potentially offer to those that are still trying to find their way?
Yeah, I think that's a great point. I think you threw that term doctor out, and it does come with kind of a stigma, right? I mean, it comes with a situation of, well, you should know everything and you should be the master of this and that. And it's so far from the truth, right? I mean, we come out as a doctor and we're clueless, right? I mean, we're a safe beginner is basically all we are. I mean, we theoretically won't hurt or kill anybody at this point. So, it's you being safe. But, my biggest thing for people out there, young doctors, is to get involved, ask questions, find a mentor. I really think that's the critical part of this, because there's some great dentists out there that would love to help you. And we have this communication situation in dentistry that's way better now than it's been, but ultimately we were kind of all shut off from one another, and very few people got to study clubs, and never went to their district dental society meetings very often. But, it's important to get involved in those things. I really feel it's just to get a network around you of people. Now with social media out there, I think it helps. I think there's a lot. I mean, social media has got pros and cons, obviously, but I think some of the real pros, yeah, some of the real pros for us is that you have the ability to reach out to someone that maybe you like, or you think they're doing something that you enjoy in dentistry or whatnot. Just a form of communication and some type of mentorship or partnership or whatever it may be. But I really think you need to get involved with your occupation, and get involved to the point that's going to challenge you a little bit. Get people that push you to your outer limits, because that's what makes you grow, right? Pushing yourself to that situation where you're not always comfortable. I mean, comfortable gets you nowhere really in life, to be honest with you, right? I mean, I think yeah, I mean, staying comfortable your whole life, yeah, you can work at it, but it doesn't really do much for you. And at the end of the day, your career's not overly happy. So key tip number one, get involved. Get involved. Find people that you like. Find people that are great mentors to you, and ask questions, because you are a doctor, but you don't know everything.
Amen. The fact that you brought up social media, that was ringing through my head as well. That there's two avenues I've always looked at when you start implementing social media into how you drive yourself. One could be that you go back and you look at all these different videos and pictures and things that are out there of what the work is being done outside of your office. You look at them, you think to yourself, man, I want to do that. I've got to mimic that, because that's really what I want to be doing in my own office. I want to be doing cosmetics. I want to be doing full mouth rehabs. I want to be doing this and that. And you can use that to motivate you, absolutely, but it can also get you down a little bit when you look at these things and you don't have the skill set to be able to achieve those high levels of aesthetics that you're actually seeing. So that's one avenue. The second, though, is exactly what you talked about, Troy. It's asking questions. It's researching it out. It's looking for those people that actually do these procedures that you're looking at on social media and thinking, how do you do this? Show me how to, and not being so prideful in your mannerisms with this, that you can actually take that in an aspect of humility and saying, I don't know everything that I'm doing. And I can admit that very, very quickly. So show me how, because when we do have that designation of doctor, let's be honest, it's hard pressed for anybody to call a dentist a doctor these days. It's just the way that it is. It's almost a joke for a lot of people, but so that's tidbit number one, is if you're looking for ways to improve, then start asking questions. Troy, that is absolutely beautiful. Have you got any other tidbits that you like to offer up?
And surround yourself with good people. I mean, I think staff and that type of thing. Get people that you enjoy to work with, right? People that you respect and people that respect you, right?
Yeah.
Don't be in a situation where everyone's trying to grow, everyone's trying to help one another, and everyone's trying to be a better person, a better dentist, a better dental office. I think that's important. I surround yourself with good people, right? And I learned that kind of the hard way, meaning holding on to staff that I should have let go a long time ago, bringing the office down. I was not happy. I didn't want to let go of that person. It wasn't a comfort level that was normal for me, right? Just once again, a lot of things that you don't get in dental school, but surround yourself with good people. Don't hold on to bad people. Keep people in your corral that are going to push you and motivate you and make you a better person.
Beautiful. Absolutely beautiful. Eh, when we talk about even a third little tidbit, you've got two. I'm going to throw one into this as well. The ability to be comfortable with failures and to learn as you are going along with things and understand that you're learning with the whole process, being okay with that. Not everything is going to go perfect. Not every single patient that you see is going to be the exact ideal situation because something is going to happen. But what my tidbit here is you're going to be okay one way or the other, depending on how you respond or react to those situations. If you are going to be trying to run your own practice, or even if you're in a DSO or whatever the situation might be, if you're in education, any of these things, as you grow, and you said it perfectly, Troy, you don't really grow that much in a comfortable situation. So as something potentially negative or even potentially something positive that happens to you, be able to learn from the bad and take that and enjoy the good as it goes on. But you get to, I guess you could even use the term, you get to choose as to how you respond in each of these situations. And if you do it in a very positive manner, your team sees it, your patients feel it, and it's something that can actually help develop your entire practice as you go forward. Would you agree?
Yeah, very well said. Yeah, I mean, that's a big one. I think that's a huge one. I mean, because it's going to happen to you. So get ready and be ready to know how you're going to handle it because it does determine a lot, especially when you're the leader on the totem pole, right? I mean, people are following what you're doing, and it can really carry you a long way, not only in terms of, people following you, but you yourself growing. You feel tremendous growth when you handle a situation like you were just talking about.
Wow, phenomenal. So, Troy, there's certain things that from Dental Advisor within our organization that we actually have products and things that we evaluate, that we go through, that we try and build that level of confidence in the materials that we're using. Because for those that are coming into a practice, that they're fairly young, or even those that are still trying to find their ways at times, then we don't really know what to do, where to go, what to use, any of that kind of stuff. So we start looking for mentors, like you said beforehand, to find out what it is that they use so that then we can say, okay, well, if he's using it and it works really well, well, maybe I should start using it in my office as well, because then that maybe will get me past some of my failures or my issues that I've had in my own practice. And I know that you have a number of things that you utilize and work with in your own practice. And what I'd like to do, if this is okay with you, given the fact that we've kind of tried to establish as to exactly who it is that we are and what we're trying to become, I'd love to have you talk about your own practice. So what I'd like to do, if you're okay with this, is to bring you back on here and in a future podcast, let's talk about what you actually utilize in your own office and see if there is something there that you can then, in that dynamic, having a basis in education, having a basis in private practice, things that you can suggest for those that are still trying to find their way, to see what type of things we can also assist from a clinical standpoint as well. Is that okay with you?
I think that'd be great. I'd love that.
Fantastic. All right. Well, Troy, thank you very, very much for joining me this morning. And for all those that have been listening in, Dr. Troy Schmedding from the Bay Area, it has been an absolute honor to have him with us. And from all of us from Dental Advisor, if you are still looking for ways to improve your practice, if you do need to find some evaluations, actually go through so that you can see what kind of products are out there and how they have been rated within all of our evaluations, please go to dentaladvisor.com. Take a look at the things that we've been looking at, and from all of us, and from Dr. Troy Schmedding and from his team. It's been a pleasure to have you, and we'll see you next time. Thank you very much.